Welcome, dear viewers. It's wonderful to have you with us again on our program. And today we're going to explore a very important topic that can directly affect your quality of life: the connection between diabetes, cholesterol, and the risk of stroke in older adults. As we enter our later years, our bodies go through many changes. This is a stage of life where we often have more time to enjoy ourselves, to be with family and friends, and to pursue long-cherished hobbies. However, along with that, health also becomes a primary concern. We often worry about chronic illnesses, about maintaining our independence and quality of life. And among those concerns, diabetes, high cholesterol, and the risk of stroke are three names that are often mentioned together. Perhaps you've heard about diabetes, about high cholesterol, and certainly about stroke. But have you ever wondered, how are they related? Why does someone with diabetes or high cholesterol have a higher risk of stroke? And most importantly, what can we do to reduce this risk? Those are the questions we will explore and answer in detail in this program. Our goal is not just to provide knowledge, but also to equip you with the tools and essential information so you can be more proactive in protecting your own health. We will talk about how to recognize the signs, how to manage these conditions, and especially how to prevent stroke most effectively. Before we delve into the details, I want to emphasize something very important. The information we share today is for general educational and informational purposes only. This is not personal medical advice. Each of us has a unique health situation, and only your doctor can provide an accurate diagnosis and the most suitable treatment plan for you. Therefore, please always consult your doctor or other healthcare professionals if you have any health concerns. To make it easy for you to follow along, we will go through each section systematically. First, we will learn the basics of what a stroke is. Then we will explore diabetes and cholesterol in turn. And finally, we will connect everything to understand the risks, and most importantly, the steps for prevention and management. Whether you are already familiar with these conditions or not, I believe you will find valuable information here. Stroke, the silent, dangerous foe. In this section, we will focus on one of the most urgent and frightening medical conditions, stroke. Understanding stroke is the first step toward preventing it and responding in time. So, what is a stroke? Simply put, a stroke happens when the blood supply to a part of the brain is interrupted. Our brains need a continuous supply of oxygen and nutrients from the blood to function. When this blood flow stops, brain cells begin to die within minutes. The consequences can be very serious, ranging from minor functional impairments to permanent disability or even death. There are two main types of stroke that you need to know about. The first is an ischemic stroke. This is the most common type, accounting for about 87% of all strokes. It occurs when a blood vessel supplying blood to the brain becomes blocked, usually by a blood clot. This blood clot can form right in an artery in the brain, called a thrombus, or travel from another part of the body to the brain, called an embolus. Imagine our arteries are like highways that carry oxygen and nutrients. If a road gets blocked by an obstacle, a blood clot, then the area behind that obstacle won't receive the necessary goods and will start to starve. The second type is a hemorrhagic stroke. This type is less common, but often more serious. It happens when a blood vessel in or on the surface of the brain bursts, causing bleeding into the brain. The spilled blood creates pressure on the surrounding brain cells, causing damage. Imagine a water pipe bursting in your house. The water not only doesn't reach where it's needed, but it also damages everything around it. Similarly, blood leaking in the brain not only causes a lack of oxygen, but also creates pressure and destroys brain tissue. Besides these two main types, we also have a condition called a transient ischemic attack, or TIA. This is a mini stroke or warning stroke. A TIA occurs when blood flow to the brain is temporarily interrupted, usually lasting only a few minutes and causing no permanent brain damage. The symptoms are similar to a real stroke, but they will go away. However, don't take it lightly. A TIA is a serious warning sign indicating that you are at high risk of having a full-blown stroke in the near future. About 1 in 3 of people who have a TIA will have a full stroke within 1 year if they don't receive treatment. So if you or a loved one experiences any stroke symptoms, even if they disappear quickly, consider it a medical emergency and seek immediate care. The most important thing is that we must know how to recognize the signs of a stroke so we can act fast. Time is gold, and in the case of a stroke, time is brain. Every minute that passes, millions of brain cells can die. We have an easy-to-remember rule to recognize stroke signs called the FAST. Rule F stands for face drooping. Ask the person to smile. Does one side of their face droop or feel numb? Is their smile uneven? A stands for arm weakness. Ask the person to raise both arms. Does one arm drift downward or is it unable to be raised? S stands for speech difficulty. Ask the person to repeat a simple sentence. Is their speech slurred, strange, or difficult to understand? T stands for time to call 911. If you or someone else experiences any one of these symptoms, even if mild, call 911 immediately. Don't hesitate. Don't wait to see if the symptoms go away. Time is critically important. In addition to the FAST rule, there are some other stroke symptoms you should be aware of, especially in women or in atypical cases. Sudden numbness or weakness on one side of the body, face, arm, leg. Sudden blurred vision or loss of vision in one or both eyes. Sudden trouble walking, loss of balance or poor coordination. Sudden severe dizziness with no known cause. A sudden severe headache, often described as the worst headache of your life, often with no history of similar headaches. Sudden confusion, trouble understanding speech, or difficulty expressing oneself. Please remember, if you suspect someone is having a stroke, do not wait. Call 911 immediately, even if the symptoms seem mild or disappear. Getting the person to the hospital as soon as possible will increase their chances of recovery and minimize brain damage. Note the time the symptoms started if possible. This information is very important for doctors. Diabetes, the sweet foe of your blood vessels. In this section, we will explore a very common chronic disease, especially in older adults, diabetes. This is not just a condition about blood sugar. It's also a major risk factor for many other serious health problems, including stroke. To understand diabetes, first, we need to understand blood sugar and insulin. When we eat, food is digested and turned into glucose or sugar, which enters our bloodstream. Glucose is the main energy source for our body's cells. For glucose to move from the blood into the cells, we need a hormone called insulin. Insulin is produced by our pancreas. It acts like a key that opens the door for glucose to enter cells, thereby keeping blood sugar levels stable. Diabetes occurs when the body cannot produce enough insulin or cannot use insulin effectively. There are two main types of diabetes. Type 1 diabetes occurs when the body's immune system attacks and destroys the insulin-producing cells in the pancreas. This type is usually diagnosed in children and teenagers, but it can appear at any age. People with type 1 diabetes need to inject insulin daily to live. Type 2 diabetes is the most common type, accounting for about 90–95% of diabetes cases, and it's the type we often see in older adults. In type 2 diabetes, the body either doesn't make enough insulin, or the cells become resistant to insulin, meaning insulin can't open the door for glucose to enter cells as effectively as it should. The result is that glucose builds up in the blood, leading to high blood sugar. At first, the pancreas might try to make more insulin to compensate, but over time, the pancreas gets worn out and can't keep up with the demand. Before developing full-blown type 2 diabetes, many people go through a stage called pre-diabetes. This is a condition where blood sugar levels are higher than normal but not yet high enough to be diagnosed as diabetes. Prediabetes is a very important warning sign. It's a golden opportunity for you to make lifestyle changes, and in many cases you can prevent or delay the progression to full type 2 diabetes. About 1/3 of adults in the United States have prediabetes without even knowing it. So, who is at risk for type 2 diabetes? Some main risk factors include age risk, increases with age, especially after 45. Being overweight or obese. The biggest risk factor. Family history, if parents or siblings have type 2 diabetes. Inactive lifestyle. Race. Ethnicity. Some groups have a higher risk. High blood pressure. Unhealthy cholesterol levels, low HDL and/or high triglycerides. History of gestational diabetes and polycystic ovary syndrome (PCOS) in women. It's important that you discuss your risk factors with your doctor. One of the problems with type 2 diabetes is that it can develop slowly, and early symptoms can be very mild, hard to notice, or even absent for many years. That's why regular health checkups are so important. However, if present symptoms can include increased thirst and frequent urination, increased hunger, unexplained weight loss, fatigue, blurred vision, slow healing sores, frequent infections, numbness or tingling in the hands or feet, and darkened skin in certain areas. If you notice any of these symptoms, don't delay, see your doctor for a checkup immediately. Your doctor will diagnose diabetes using simple blood tests like a fasting plasma glucose (FPG) test, an HbA1c test, or an oral glucose tolerance test (OGTT). Early diagnosis is key to effective management and preventing serious complications. Cholesterol, the villain and the silent hero. In this section, we're going to demystify a concept that many people still misunderstand: cholesterol. Cholesterol isn't always bad. It has both good and not so good sides. Understanding it clearly is key to protecting our heart and blood vessel health. Cholesterol is a waxy fat-like substance found in our blood. Many people think cholesterol is an enemy, but in reality, cholesterol is a necessary substance for our body to function normally. Our bodies need cholesterol to build healthy cells, produce hormones, make vitamin D, and produce bile acids to digest food. Most of the cholesterol in our body is produced by the liver. A small portion comes from the food we eat. The problem isn't having cholesterol, but having too much of the bad kind and not enough of the good kind. Cholesterol cannot travel by itself in the blood. It has to be transported by proteins forming small packages called lipoproteins. There are three main types of lipoproteins you need to be concerned about: LDL, low-density lipoprotein. The bad cholesterol LDL carries cholesterol from the liver to the cells. When there's too much LDL, it starts to dump excess cholesterol into the artery walls, leading to the buildup of fatty plaques, which causes atherosclerosis. So, we want low LDL levels. HDL, high-density lipoprotein, the good cholesterol. Conversely, HDL collects excess cholesterol from the arteries and carries it back to the liver to be removed from the body. HDL helps prevent and can even remove plaque buildup. So we want high HDL levels. Triglycerides, another type of fat. Triglycerides are another type of fat found in the blood. The body converts excess calories from food into triglycerides and stores them in fat cells. High triglyceride levels, especially when combined with high LDL or low HDL, can increase the risk of heart disease. We want low triglyceride levels. So how does high cholesterol relate to stroke? The main culprit here is a process called atherosclerosis. When there's too much LDL cholesterol in the blood, this cholesterol begins to build up and form plaques inside the artery walls. These plaques are not just cholesterol, but also fat, calcium, and other substances. Over time, these plaques grow larger and harden, causing the arteries to narrow and stiffen. This is like a water pipe in your house getting clogged with mineral deposits, restricting the flow. When arteries become narrower, the supply of oxygen-rich blood to the brain or heart is reduced. A more serious problem occurs when one of these plaques ruptures. When a plaque ruptures, the body reacts by forming a blood clot at the site of the damage to patch the tear. This blood clot can quickly completely block the already narrowed artery. If this blockage occurs in an artery leading to the brain, it will cause an ischemic stroke. Or a part of the blood clot can break off and travel to smaller blood vessels in the brain, causing a blockage there. Similar to diabetes, many factors can increase your unhealthy cholesterol levels. Unhealthy diet high in saturated and trans fats. Being overweight or obese. Lack of physical activity. Smoking age. The liver has more difficulty removing LDL as we get older. Genetics and other medical conditions, like chronic kidney disease, hypothyroidism. High cholesterol often has no symptoms. This is why it's often called the silent killer. The only way to know if you have high cholesterol is through a simple blood test called a lipid panel. This test measures total cholesterol, LDL, HDL, and triglycerides. Your doctor will explain your results and make recommendations based on your individual risk factors. Adults over 20 years old should have their cholesterol checked at least every 4-6 years or more often if they have risk factors. The dangerous connection: diabetes, cholesterol, and increased stroke risk. We've learned about stroke, diabetes, and cholesterol separately. Now let's put the pieces together to understand why, when diabetes and high cholesterol combine, they form a dangerous alliance that significantly increases the risk of stroke. Let's start with diabetes. When blood sugar levels are high for a long time, it causes a series of damages to our blood vessels. High blood sugar damages the inner lining of the artery walls. also known as the endothelium. This endothelial layer is usually very smooth, allowing blood to flow freely. But when damaged by sugar, it becomes rougher and stickier. This creates favorable conditions for bad cholesterol LDL and other fats to stick to it, initiating the process of atherosclerotic plaque formation. Besides directly damaging blood vessel walls, diabetes also causes other negative effects. It increases chronic inflammation in the body, causing arteries to be damaged faster and making the process of atherosclerotic plaque formation worse. In addition, people with diabetes often have an unhealthy trio of cholesterol low HDL levels, high triglyceride levels, and smaller, denser LDL particles, which are more likely to stick to blood vessel walls. This combination is a perfect recipe for the rapid development of atherosclerotic plaques. What's more, diabetes also increases the likelihood of blood clot formation. High blood sugar can make the blood thicker and increase the activity of clotting factors. When blood clots more easily, the risk of forming blood clots in the arteries, which are already narrowed by atherosclerosis, significantly increases, leading to ischemic stroke. While diabetes is weakening and inflaming blood vessels, high cholesterol, especially high LDL, adds fuel to the fire. When blood vessel walls are already damaged by high blood sugar, LDL cholesterol can more easily penetrate the inner layer of the artery walls. The combination of damaged blood vessel walls and abundant bad cholesterol accelerates the rate of atherosclerotic plaque formation and growth. The most worrying thing is that diabetes and high cholesterol don't just add to the risk of stroke, they multiply that risk. This is a phenomenon called a synergistic effect. In other words, someone who has both diabetes and high cholesterol has a much higher risk of stroke than someone who has only one of the conditions. They create an ideal environment in the body for severe damage to the arteries, causing them to narrow and making them prone to forming blood clots that cause stroke. And often both diabetes and high cholesterol are accompanied by another stroke risk factor: hypertension, high blood pressure. Hypertension is when the blood pressure against the artery walls is too high, continuously damaging the blood vessel walls, making them stiff and narrow. People with diabetes often have a higher risk of high blood pressure. Similarly, high cholesterol also contributes to arterial stiffness, forcing the heart to pump harder, leading to high blood pressure. When these three factors, diabetes, high cholesterol, and high blood pressure, coexist, your risk of stroke increases exponentially. They form a deadly trio that directly threatens brain health. Although we focus heavily on ischemic stroke, due to blood clots, diabetes and high cholesterol also indirectly increase the risk of hemorrhagic stroke. High blood sugar and unhealthy cholesterol contribute to weakening and stiffening the small blood vessels in the brain. When these blood vessels become fragile and more likely to burst, especially when combined with uncontrolled high blood pressure, the risk of a blood vessel rupturing and causing bleeding in the brain increases. We as older adults have a higher risk for several reasons: accumulated damage from many years of exposure to risk factors, reduced ability of the body to recover, often having multiple underlying conditions at once, and natural physiological changes with aging also affect blood vessel function and metabolism. You see, this connection is complex and dangerous, but the important thing is we are not helpless. Understanding these connections is the power that allows you to proactively take steps for prevention and management. We can control many risk factors, and that is our hope. Management and prevention, proactively protecting your health. Welcome to the most important part of today's program. We have understood about stroke, diabetes, and cholesterol, as well as the dangerous connection between them. Now, the important thing is what we will do with this knowledge. In this section, we will focus on effective management and prevention strategies to help you proactively protect your health. Prevention is always better than cure, and in this case, that's truer than ever. Even if you have been diagnosed with diabetes or high cholesterol, good management can significantly reduce your risk of stroke. Remember, every health management plan needs to be personalized and under the guidance of a doctor. Your doctor knows your health status best and can provide the most suitable advice. Don't hesitate to ask questions and actively participate in your own healthcare. Strategy 1. Healthy eating. Nutrition as medicine. Diet is the foundation of good health, especially important in controlling diabetes and cholesterol. Let's look at some key principles. Limit sugar and refined carbohydrates. Sugars and refined carbohydrates quickly raise blood sugar, put stress on the pancreas, and contribute to insulin resistance. Replace sugary drinks with water, unsweetened tea, black coffee, and choose whole grains instead of refined grains. Choose healthy fats. The type of fat you eat significantly affects cholesterol levels. Limit saturated fats, red meat, animal fat, butter, full-fat dairy, coconut oil, palm oil, and avoid trans fats, junk food, fried foods, packaged baked goods. Prioritize monounsaturated and polyunsaturated fats found in olive oil, avocados, nuts, and fatty fish. Increase fiber. Fiber, especially soluble fiber, helps slow down the absorption of sugar into the bloodstream, helping to stabilize blood sugar, and also helps reduce LDL cholesterol. Eat plenty of fruits and vegetables and add whole grains, beans, and legumes. Control portion sizes. Even healthy foods can lead to weight gain if eaten in excess. Portion control helps manage weight and blood sugar. Use smaller plates, pay attention to your body's fullness signals, and spread your meals throughout the day. 2 widely recommended eating patterns for heart health and diabetes management are the Mediterranean diet, focusing on vegetables, fruits, whole grains, beans, nuts, olive oil, fatty fish, limiting red meat and sugar, and the DASH diet, focusing on fruits, vegetables, whole grains, low-fat dairy, poultry, fish, nuts, beans, and limiting sodium-saturated fat, cholesterol, and sweets. Talk to your doctor or a registered dietitian to create a suitable eating plan. Strategy 2. Regular physical activity. Your body is meant to move. Physical activity is one of the most powerful medicines we have. It not only helps control weight, but also improves insulin sensitivity, lowers blood sugar, increases HDL, and lowers LDL triglycerides. The general goal is to aim for at least 150 minutes of moderate intensity physical activity per week, which can be brisk walking, swimming, cycling, broken down into 30-minute sessions 5 times a week. Incorporate strength-building exercises at least twice a week. Suitable types of exercise for older adults include walking, swimming, or water aerobics, safe cycling, tai chi, or yoga light weights, or resistance bands, and gardening. Always consult your doctor before starting any new exercise program. Start slowly and gradually increase intensity. Listen to your body and don't push yourself too hard. Strategy 3. Maintain a healthy weight. Lightening your body's burden. Losing weight, even a small amount, can make a huge difference in managing diabetes and cholesterol, thereby reducing stroke risk. Excess fat, especially belly fat, increases insulin resistance and contributes to the production of bad cholesterol. Losing just 5 to 10% of your current body weight can bring significant health benefits, including improved blood sugar, cholesterol, and blood pressure. The way to do this is by combining a healthy diet and regular exercise. Strategy 4. Quit smoking and limit alcohol. Protecting your body. These are 2 factors that you can completely control, and they have a very significant impact on stroke risk. Smoking is one of the biggest and most controllable risk factors for stroke. It damages blood vessel walls, increases plaque formation, and makes blood clot more easily, while also increasing bad cholesterol and lowering good cholesterol. Quitting smoking is the best thing you can do for your blood vessel health. Seek support from your doctor or smoking cessation programs. Drinking too much alcohol can raise blood pressure, increase triglycerides, and contribute to weight gain. If you drink alcohol, do so in moderation. No more than 1 drink per day for women, and no more than 2 drinks per day for men. Strategy 5. Manage stress, keeping your mind at peace. Chronic stress can negatively impact overall health, including stroke risk. When stressed, the body releases hormones that can raise blood sugar, blood pressure, and cholesterol. Stress can also lead to unhealthy behaviors. To manage stress, practice relaxation techniques such as deep breathing, meditation, yoga. Make time for hobbies. Maintain social connections. Get enough sleep, 7 to 9 hours per night. And seek professional help if needed. Strategy 6. Adhere to medical treatment and regular checkups. Your doctor is your ally. This is perhaps the most important strategy, especially if you have been diagnosed with diabetes, high cholesterol, or high blood pressure. Always take your medications exactly as prescribed by your doctor. Do not stop or adjust the dose on your own. If you experience side effects, inform your doctor. At the same time, do not miss your regular checkup appointments. These appointments help your doctor monitor your health, check important indicators, and adjust your treatment plan as needed. Be sure you understand your numbers and your target goals. For blood sugar, the target fasting plasma glucose FPG is usually below 100 mg/dl and HbA1c below 5.7%, below 7.0% for people with diabetes. For cholesterol, ideal total cholesterol is below 200 mg/dl, LDL below 100 mg/dl, HDL above 60 mg/dl, and triglycerides below 150 mg/dl. Normal blood pressure is below 120/80 ml/H. Ask your doctor to understand your specific goals for each of these numbers. I want to emphasize once again the importance of quitting smoking and limiting alcohol. As soon as you quit smoking, your risk of stroke and heart disease begins to decrease. Within a few years, this risk can drop to nearly that of a non-smoker. For alcohol, moderate consumption is very important, or complete abstinence depending on your health condition. The fact that you are watching this program shows that you are proactive in seeking information. Continue to educate yourself about your health condition from reliable sources. More importantly, share this knowledge, especially the FAST rule, with your family and loved ones. They are the ones who could save your life in an emergency. No matter how hard we try to prevent it, having an emergency plan is still necessary. Always have 911 or your local emergency number readily available, an updated list of all medications you are taking, and contact information for your doctor and emergency contacts. When a stroke is suspected, every minute counts. Do not drive yourself to the hospital. Call 911 so that paramedics can be fully equipped and begin treatment on the spot or en route. And if unfortunately a stroke does occur, life still goes on. The recovery process after a stroke is a long journey and requires a lot of patience, including physical therapy, speech therapy, and occupational therapy. Starting early and being persistent are very important. Psychological support and family support are crucial. After a stroke, managing diabetes and cholesterol becomes even more important to prevent a recurrent stroke. A message of hope and action. Dear viewers, we have journeyed together to deeply explore the connection between diabetes, cholesterol, and the risk of stroke. We've learned that stroke is a medical emergency requiring us to recognize the FAST signs and call 911 immediately. Diabetes and high cholesterol damage blood vessels, increase inflammation, disrupt lipids, and promote plaque formation, significantly increasing stroke risk, especially when there's a synergistic effect and when combined with high blood pressure. The biggest message I want to convey to you today is, you have the power to make a difference in your own health. While some risk factors cannot be changed, most stroke risk factors are within our control through healthy eating, physical activity, maintaining a healthy weight, quitting smoking, limiting alcohol, managing stress, and adhering to medical treatment with your doctor. I encourage you to start today. Talk to your doctor to get a general health checkup and ask about your numbers. Choose one or two small lifestyle changes that you feel are easiest to implement and start there. And please share this knowledge with your family and friends to build a healthier community together. Once again, I want to reiterate, the information in this program is for general educational purposes only and does not replace personal medical advice. Please always consult your doctor for any decisions related to your health. Thank you for tuning in today. I hope this information has given you a clearer understanding and made you feel more confident in managing your health. Remember, our health is our most precious asset. Take good care of it. I wish you and your family always good health, peace, and much joy. See you again in our next programs.